Okay, hi, my name is Cassie. I'm going to be your nurse today, and I am going to be teaching you about the new inhaler that you got for asthma. And it looks like you have somebody here with you today. Who is this?
Yes, this is my granddaughter Mason.
Granddaughter.
I brought her with
Perfect.
because I might forget some things, so
Okay.
she's here to help me.
Okay,
Remember.
do you help her with a lot of her medications?
Yes.
Okay, perfect. So this is the metered dose inhaler. You have Symbicort was prescribed to you. You're going to take that 2 times a day, and with each administration, you're going to give yourself 2 squirts. So a little bit of maintenance before we get started. So this is your inhaler. It comes apart just like this. You can wash this part of the inhaler. Don't wash this. But you can wash this, every week or so just to make sure that it doesn't get too gunky. And this cover comes off. And then this just goes back in here nice and easy. When you pick up your inhaler from the pharmacy, you're just going to want to make sure that it's working. So you're just going to push down on this and see if the medication comes out. You might have to give it a couple pushes before the medication comes out. Do you want to try?
And what's this called again?
It's a metered dose inhaler.
And I squeeze it?
Yep. Just like that.
Okay.
Pretty simple.
Okay.
So there are 2 different ways to administer this medication, or 3 different ways, I suppose. If you're going to be helping her, the open mouth technique might be a little bit more useful. So for that, you're going to hold the inhaler, and you're going to hold it 2 inches away from your mother's mouth or grandmother's mouth, and you're going to have her take slow, deep breaths. And on one of her inhales, you're just going to squeeze the button, and she's going to inhale that medication. After you give the first administration, you're going to wait 1 to 2 minutes, and then administer the second dose. Does that make sense?
Right. Should she hold her breath at all?
Yep, so she'll hold her breath for about 10 seconds or so, or as long as she can, and then wait the 1 to 2 minutes before the second dose. Okay. And then another technique you can use is the closed mouth technique. This is more for if you're going to give this medication yourself. So you'll just take the cap off. You're going to put your mouth around this part. You're going to take those nice, slow, deep breaths. You're going to exhale, and then when you inhale, you're going to squeeze the button at the top to give that medication. And again, you will hold your breath and then wait the 1 to 2 minutes before you give your second dose. Okay?
And so can I take like all 4 puffs at once, or?
Nope, so you're going to want to wait 12 hours between the 2 puffs. So if you take it in the morning, you'll take 2 puffs in the morning, and then you'll take the 2 puffs at night before you go to bed. So you're going to want to make sure that there's at least 12 hours in between administrations.
And that's, I'm sorry, what's that called again?
This is a metered dose inhaler.
Okay.
Yep.
Is there maybe an easier technique?
Yes, I was just about to get to that.
Oh,
perfect. So this thing is a nifty little doodad that you can use. It is called a spacer. And to use this, you'll take the cap off and you'll administer it into this end, or put the cap into this end. And then you'll take this off and you'll put this into your mouth. And you'll just breathe nice and easy, slow, deep breaths. And you'll push this button. The medication's kind of going to linger in this container for a little bit and just give you a little bit more time to get all of that medication. One of the benefits of this is it will allow you to get more medication into your lungs just because we have a little bit more time to breathe.
Oh, okay.
Yep. And then you'll just want to make sure that you're washing this as well. After you've administered the medication, make sure that you are rinsing your mouth out just because this can cause a fungal infection in the mouth. But make sure that you're not swallowing the water. Make sure you're spitting it out, okay?
So I don't swallow.
No, do not swallow the water. You'll just rinse and spit.
Okay.
Yep. So this is not a rescue inhaler, so you will just use this as needed. If you feel like you're getting a little bit gunky in the lungs, having a little bit harder time to breathe, you can give it a little bit early. Just make sure that you're waiting that 12 hours in between your doses. If you feel like you're having a hard time catching your breath, this isn't relieving your shortness of breath, you're feeling nauseated, vomiting, anything like that, give us a call and we'll come in and
Okay.
Do you have any other questions at all?
So one of Grandma's friends has an inhaler as well, but it's not the same as that. It's like a
Okay.
round thing.
Yeah, so that's actually a different type of medication. That is usually a powdered medication in those round little discs. That's different in the fact that this comes out when you squeeze the top of this, so it comes out. And with the powdered medication, it comes in it almost looks like little pill packets. You put that into there and it punctures it, and the only way to get the medication is by breathing in. So they're different medications.
And that one's called a
A metered dose.
metered. Okay.
Yep.
Okay.
Yes. Do you have any other questions at all?
So, I mean, I'm an old grandma, so I drop things a lot.
Yeah. So if you do drop this, just make sure that, you give it the squeeze, make sure the medication is coming out. And if that medication isn't coming out, then you can give us a call or the pharmacy and we can,
Okay.
get you a new one.
And what happened? Like, do I test it every time? Like, do I?
Nope. If you are going to be taking this every day, it's ordered every day, twice a day. So you will not need to test it every single day.
Oh, okay.
But if you do go longer periods of time without taking it, like a day or two, then I would just push the button at the top and make sure that it's working.
Okay.
Yep. And this medication is a bronchodilator and a corticosteroid. I'm not sure if I mentioned that at the beginning, but those medications are designed to open up your airways and help with any inflammation that's in there. So it should help you feel better for the most part.
Okay.
Yep.
And I can't remember if I asked this earlier, but when I inhale it, do I have to, like, can I just breathe it out right away, or do I have to, like, keep it in?
No, so you will hold your breath for 10 seconds or as long as you can when you inhale it. And then when you breathe out, just, breathe nice and slow through pursed lips. So we're not just puffing all of it out.
Okay, and I inhale when I administer that?
Yep.
Okay.
Yep, so you're going to take a nice deep breaths in. Yep.
Okay. Okay. Do you have any questions, Mason?
No, I don't think so.
Because I think I'm good.
Okay, perfect, wonderful.
Okay. Thank you.